So let's look at the 4 functions of the mouth mirror. So probably one of the most common uses of the mirror is for indirect vision. So I am holding the mirror in kind of a pen grasp, and then I'm resting with a fulcrum finger against the canine at the moment while I visualize the lingual of the upper right. Now when I do this, it'll sometimes catch the light from the operatory light. I don't have an actual operatory light here, but it's catching the overhead light a little bit. You can kind of see it's illuminating those linguals a little bit. So a lot of times when you're using it for indirect vision, it's also illuminating the area. It can also be used for retraction. So when you retract, you want to make sure that you're far enough into the patient's mouth so that you're not just kind of grabbing the corner of their lip. It's not very stable to do that, and it's also uncomfortable. So go all the way into the buccal mucosa and then retract, and then you can also pull up again. You want to make sure that you're not resting against the patient's alveolar bone or any other hard surface that could be uncomfortable for them. So people think sometimes that they want to retract really gently, but often that doesn't really do any good and doesn't feel very stable when you add all the slippery saliva that's in the mouth. So do be sure to go all the way back into the mouth and then retract, and you can pull out, just do so gently. You can also use the patient's face and cheek as a stabilizer, so an extraoral fulcrum, just by resting your hand or your fingers against the exterior of their face. So you can also retract so that you can visualize and illuminate. So here we're using 3 functions. We are retracting, we are using it for indirect vision, and we are getting some illumination from it as well. On the lowers, you can retract the tongue with it. And you also want to make sure you don't dig into the floor of the mouth with the mirror. That's very uncomfortable. We can also retract against the cheek in order to visualize the facial surfaces. And with the mirror in the same position, we can retract the tongue on this side to visualize and retract on the lingual of the lower right. We also use the mirror for indirect vision and illumination along the mandibulars, the mandibular anterior incisors, as well as on the upper incisors. Transillumination is pretty difficult on a typodont, and again, I don't have an operatory light here to do it, but you want to kind of catch the light and shine it through the teeth, and then if there is decay, you will be able to see the shadows in the enamel. So you just want to kind of tilt your mirror until you catch the light in such a way that it kind of makes these teeth glow a little bit.